Thank you for the introduction to the table. Good morning to all. This is the results from a graduation student of our degree. The talk is about patients' perceptions of radiation therapists in communication skills. The improvement of results in healthcare through the transmission of information to the patient within a relation of empathy and trust is already verified as an hypothesis. Healthcare professionals should base themselves interpersonal competence through their daily work routine to promote quality in diagnosis, patient safety and technical excellence. I propose evaluate patient perceptions regarding the performance of the radiotherapist in terms of interpersonal communication skills, fortify the idea that the patient is the central figure in the entire healthcare system and that all the professional practice of the radiotherapist should be adapted to the holistic and multidimensional human being that is the patient, and to verify that the professional practice is carried out in accordance with the policy of respect for the Radiotherapist Code of Ethics and the Charter of Patient Rights and Duties. So, our study type was quantitative, descriptive, and correlational. Our instrument, it was the self-applied questionnaire communication assessment tool adapted from Makoul et al. 2007. Is a questionnaire with 15-item tool with 5-point scale to poor to excellent. And our sample was composed by 118 patients, 68 of them females and 50 men, age between 22 and 87 years old. After the subject to at least 5 radiotherapy sessions. It was made in a private radiotherapy center. Here we have the descriptive statistics. You can see in gender we have almost 55% of the sample, less men than women. The ages, most of our sample was above 45 years, and the level of studies we can see at green, most of them have high school. And data that is very important is the number of treatments. You can see in green and that kind of blue, close to gray, most of the patients had more than 30 treatments. So the results of the pilot study indicate that the instrument is internally consistent and have a high relativity scale with a Cronbach coefficient alpha of 0.97. The highest ratings was the radiotherapist behavior, the respect for the patients, using comprehensive language and terms, paying attention to the patients, and the lowest ones, it was explain the treatment plan, encouraged to make questions. We can see also in general, in all the questions, they point above 4, but we can see treat me with respect with one of the highest values in the mean, and paid attention to look to me also as one of the highest ranked. And at the end, the radiotherapist conduct. Peers correlation, also with high values in most of the items. You can see the lowest one, it was the item from the 12 numbers, 12 question, sorry. Our discussion. Communication with the patient takes an important part in providing quality health care. As such, interpersonal and communication skills are considered a core area of competence. An efficient interaction with the goal of providing a humanized care in radiotherapy has many benefits, such as effective patient clarification, increasing psychological well-being, increasing predisposition to return for next treatment, and is very important in radiotherapy, increasing satisfaction. In conclusion, the patient's point of view, the radiotherapists showed respect and interest in their opinions, provided all the information using accessible language, and confirmed that the patient was understanding all the information. However, there are aspects that still needed to be improved, such as the radiotherapist should encourage patients to clarify all their doubts, and the radiotherapist was able to establish an adequate communication with the patient, but there are aspects that must be improved in order to provide, and this is very important, informed consent health care to the patient, because the patient needs to know what kind of treatment is submitted and the risk that is exposed. So, thank you for the attention.